Hi, everyone. I really want to thank you for taking the time out of your busy lives to come and talk about Dad or Papa. What we have to discuss tonight is really important for everyone to know. Some of the things that we may talk about tonight may be difficult to hear, but we would like this meeting to be a forum for all of the questions that you have. Or if you think of something later on, please feel free to ask. My phone is always on, and I am always available for a chat. So today, we're going to do an overview of some of the medical issues that Papa has, how they make them feel, and what to expect in the future with some of these issues. There is a lot of history here. Papa was an All American athlete in high school. He played football, basketball, baseball, track. He was the actual All American guy in high school. 4 short years after high school, he was drafted into the Army and sent to Vietnam. This is the beginning of his medical journey that has affected all of the aspects of his life. Let's start from the ground up as we talk about the medical issues that have plagued Papa in the past and currently. This overview may give you a perspective on how Papa feels daily as well. So, plantar fasciitis, if you've ever wondered how your feet stretch and move so well, it's because of a long rubber band like ligament on the bottom of your foot called the plantar fascia. So, if you have fallen arches or flat feet, or have injured this ligament in any way, you know that the pain of not being able to walk very well is just terrible. The disorder it's called is plantar fasciitis. It's an inflammation or swelling in that particular ligament called the plantar fascia. Once it is stretched or overused, it becomes painful and makes walking painful. Papa spent years and years on his feet in the grocery business, and now he requires orthotics to keep his feet from hurting too much. Plantar fibromatosis is just a fancy word for a growth on that specific rubber band like ligament. This growth is often small and it grows pretty slowly, but it can feel like you're walking on or standing on a small rock. These are harmless growths, and you can't see me, but I put air quotes there. And I because they aren't linked to any cancer or anything devastating, but they can be bothersome and painful when you're walking or standing. So if you notice that you feel something of this nature on the bottom of your foot, you should get it checked out. So, okay, let's move on to his legs. We all know that Papa has had both of his knees replaced, but did you know that he's had more issues that make walking long distances painful and uncomfortable? So, Papa's had several issues that impact his legs and how they function, and these are just some of the issues that we will touch on today: the varicose veins, the deep vein thrombosis, and the intermittent claudication. All of these affect every aspect of the way that Papa walks and functions. So let's first talk about how Papa's circulation works in his legs. There's two types of ways that blood gets in and out of your extremities. The arteries bring oxygenated blood in and they are under pressure. They push blood out to the furthest places in our bodies, and once the oxygenated blood is pushed into our muscles, legs, and toes, the oxygen is transferred into the cells so they can continue to work. Once the oxygen is moved over and the deoxygenated blood is returned to the heart through the veins. Our veins are not pressurized, and they rely on muscle movement to help open and close the little valves in the veins to move the blood back to the heart and lungs so it can be reused and reoxygenated. Well, knowing all of that, sometimes when you stand or sit for a very long time, you can develop twisted veins called varicose veins. These veins are usually very close to the surface of the skin, and if you've ever seen Papa with his shorts on, they are very visible on his lower legs and ankles. They are bluish purple in color and often bulge out and are visible with the naked eye. These veins can be painful and itchy. Also, they can be places where blood cells get stuck together. So the next thing that we're going to talk about is deep vein thrombosis. So once the deeper veins start to get backed up and the red blood cells stick together, they can form a blood clot or a thrombus. That's just a fancy word for a clot that doesn't move. These clots, once they get big enough, can block the vein enough to make it possible for blood not to be able to pass through. This in turn causes pain, swelling, and redness in the leg, and this requires medical treatment to take care of those clots to prevent them from breaking loose and traveling to unwanted places. These issues can happen to anyone, but are most common after an injury in the lower legs or any time there is a disruption in the way the blood moves through the legs, like having surgery, swelling in the lower legs, sitting for too long without moving your legs around. So for someone like Papa, we know he's had several surgery on his legs, and the veins in his legs have pretty much a lot of issues. He's been hospitalized more than once for this issue. So, if left untreated, these clots can cause serious issues. The main issue being a clot that gets dislodged and travels into a place that we don't want it to be, like the lungs. This can cause a pulmonary embolism, which can be bad, and we'll talk about this more later. So, intermittent claudication is just a fancy word for leg pain, and this is a predictable pattern of leg pain that is caused by inadequate blood flow to the exercising muscles. So we've already established that Papa has some pretty serious vascular issues that is caused by narrowing of the arteries by cholesterol or fatty acids. Those are called, that type of issue is called arteriosclerosis. This is a symptom of peripheral vascular disease. So if you look at this little diagram that's shown up on the screen right here, all of this yellow inside of this artery is a buildup of plaque or cholesterol, a fatty acid. So once that builds up far enough, it starts to block off the way that the blood vessels carry oxygen to and from the heart. So as it closes down more, you can see that there's not a lot of blood flow moving through there. So this damage can happen from factors like high cholesterol and high blood pressure. Now let's move on to Papa's torso. Now that we've worked up the legs, the main areas we want to touch on for his torso are his lungs, his heart, and his back. Papa has had a couple of surgeries here too that can disrupt things. Let's talk about Papa's back for a few minutes before we get into the other stuff. Papa has what we refer to as spondylosis. This is another one of those fancy words that means osteoarthritis, or bone or degeneration in the bones. That means that the cartilage within the joint begins to break down and the underlying bone begins to change. Cartilage is that soft, pliable tissue in your ears and your nose that kind of allows movement. Once that cartilage that sits in between your bones breaks down, your joints begin to rub together and hurt. Papa's had his spine fused together with plates and screws to help prevent further damage to his spine. So let's talk about the lungs and why it's important that we keep our legs and veins healthy. So in the past, Papa has had a pulmonary embolism, and like we talked about before, those are often from deep vein thrombosis somewhere in his body that came loose and became a mobile clot or an embolus. It moved into a place where it didn't belong, the lungs. If this was left alone for too long, it could prevent blood flow from flowing freely from the heart into the lungs and for reattaching of oxygen. If this isn't treated immediately, it can cause damage to that part of the lung and even cause the lung to die. Luckily, the one that traveled into Papa's lungs was found fast and didn't remain in an area that would cause further damage to his lungs. Let's talk about Papa's heart. So in December, he had a stents placed. So we know that Papa's veins have been impacted by the vascular disease he has, and the arteries in his heart have also been weakened and damaged. That procedure in December, they placed stents into those arteries, which you can see in the little diagram right here. They put a little wire stent in, they expand the balloon, which opens up the artery. These arteries can be damaged by years of undermanaged high blood pressure and higher than normal cholesterol, but they can also be damaged by being exposed to toxic chemicals like the ones they used during Papa's service in Vietnam. A combination of all three of these factors could have led to the damage in his heart. So finally, let's talk about Papa's head and neck. I know I would like to prepare you for some of the things that will be presented, and I know not everyone will be fully okay with everything that's going to be talked about, but they are really important topics to cover. So, this event is that's a transient ischemic attack is an event that saved Papa's life back in 2015 or 2013. I can't remember which one. This TIA, or transient ischemic attack, or mini stroke as we like to call it, only lasts a few minutes or, roughly under an hour. And if you look at the picture at the top left diagram, it shows the anatomy of a healthy artery. Well, we have already established that Papa's vascular disease is pretty extensive. So this mini stroke happened when Papa was here in Utah. The reason I say it saved his life is because of this TIA. Papa was able to have his head CT, and that head CT showed that his carotid artery, or the main artery that carries oxygenated blood into his brain, was almost 90% blocked. And there was an aneurysm forming, or a bulging weak spot. Had this not been found when it did, that bulging spot could have ruptured. So it is very important that we all take some precautions by managing our cholesterol and high blood pressure. So there's always never an opportunity for us to learn something. So this acronym is something we should all be familiar with. Whether stroke symptoms are suspected, we act fast. So F, did you notice facial drooping on one side? A, is there arm weakness on that same side? S, is that person having speech difficulties? If so, it's T, time to call 911 immediately. Most stroke damage can be reversed in the first 2 hours if caught in time, and special medication is administered. So, if you suspect symptoms are happening, call 911. If symptoms are allowed to go on longer, there can be permanent deficits in speech and extremity paralysis, as well as other motor functions. I know most of you have seen that scar on Papa's neck. This was the surgery that was performed in response to that TIA that Papa had. It was found early, thankfully, and he was able to have the artery replaced. So let's talk about the most recent diagnosis of dementia, and this is going to be the last topic that we talk about tonight. So dementia is a broad term that can encompass a lot of different types of dementia. We are just going to focus on the most common type, that is Alzheimer's disease. We will discuss the three stages and the signs and symptoms that can be experienced in each stage. So, Papa is currently in this stage as we speak, mild dementia. He's still functioning independently. He still participates in family activities, cards, games, and lively conversations. Sometimes, though, he may feel as if he's unable to find a word, forgot where he was going, or forgot what the conversation was about in a matter of seconds. But at some point, we'll be able to recover quickly enough to move on with the conversation. He may have issues organizing and planning things in the future as well. As the dementia progresses, he will develop the symptoms of moderate dementia. He could be in this stage for years, and some of the symptoms can be worse than others. He may begin to be more forgetful of events or his own personal history. He can be moody or withdrawn when placed into a challenging social situation. Sometimes he can be unable to recall his address or phone number, or not know what specific day it is. He may start to have issues with choosing clothing and may require more assistance in the bathroom areas. So at this point, we would start to enable the services of a caregiver to help Mima navigate those daily tasks. Some of the more worrisome issues that can happen are changes in sleep patterns and being restless at night. Once we notice these issues, there are medications that can be used to help regulate his sleep. Keeping Papa in a safe environment and avoiding him being left to wander will be important. He may have some behavioral changes as well, and those can be mitigated by medications as well to help keep Papa from hurting himself. I know these are troubling things to think about, but if we discuss them now and know what to look for, we can help mitigate the symptoms before they become troubling or dangerous for Papa. So, severe dementia or late stage dementia are often the most troubling and severe, hence the word. Papa could lose the ability to respond to conversation, understand or speak in coherent sentences, and this could be at the point where Papa would benefit from 24-hour care. This is where the VA benefits would be very helpful in making sure that Papa's quality of life doesn't diminish. So, losing awareness of recent experience as well as his surroundings, these changes often will make him vulnerable to infection, pneumonia, injuring himself. So 24-hour care would be an appropriate place for him to be at this point. So our brains are the computer systems of our bodies. They are small, but a lot of information is stored there. It only weighs 3 pounds and it has the texture like firm jelly. It has 3 main parts. The cerebrum, it contains all of our higher functions such as problem solving, feelings, and coordinated movements. The cerebellum sits underneath the cerebrum and controls our coordination and balance. This part of the brain allows you to walk and talk at the same time. The brainstem sits at the bottom of the cerebrum and it's connected to your spinal cord and it controls all of our primal functions, the things that our body does automatically, like breathing, regulating heart rate and blood pressure, and these are the last functions to go. I show you this to really give you a picture of what this disease dementia means. There is a significant nerve and brain cell death over time, and it's a loss that drastically changes the way the brain thinks and acts. I know this is a hard picture to imagine, but it's really the reality of the situation that we are facing. So now that we've discussed all of the really hard topics, it's time to remember that we are a strong family. We have the ability now to support Mima in the care and comfort of Papa while he goes through this process. So it will be up to us to make sure that Mima is doing okay, checking in on her. When they visit us in our respective homes, we are educated on some of the things to expect in the future, and we have the ability to adapt accordingly to accommodate them during this time. When the time comes that Papa needs a higher level of care, we can support Mima in her decisions regarding this matter. The next few weeks are some of the very important because things are happening that we will need your help with. Papa will have a compensation and pension exam. This exam and all of the data received from this exam will be provided to the VA, and we then determine if Papa's disability rating of 60% will be raised. We are hoping to present enough evidence to make it very easy for the VA to award him the rating of 100% permanent and total disability. But in case the VA decides to hold out, we want to be prepared with an ironclad appeal. This is where your ability to help right now comes in. My good friend Logan is here to help us understand the process and how we can help. I really want to thank you all for coming and participating in this conversation tonight.